Thanks for joining us on EM in 5. Today I want to talk about the elbow x-ray and how to interpret it. So here's a good system. It goes through 5 things that you're going to look for on every elbow x-ray, and we're going to go through each of those. So let's start off with number 1. That's the figure 8. Now this is basically a finding on the lateral x-ray to make sure that it's a good x-ray, to make sure it's aligned appropriately. So what we're looking for is this figure 8. You can see it goes up and around here. So there's a normal figure 8. That's good. It just means that your x-ray is appropriately aligned. So let's take a look at another one. Here's a slightly younger patient, and you can see there's your figure 8. So here's one looking at it. I don't see a figure 8 there. That means the rest of our exam is not going to be very good. We need to retake this x-ray. Okay, so there was number 1, the figure 8. Number 2, we're going to look at the fat pads. So we're going to look at the anterior and posterior fat pads. And this is a sign that there might be an occult fracture that we can't really see. So first off, let's look anteriorly. So it's normal to have some fat pad. You can see it here. It's this dark area right in front of the bone. And it's normal to have an anterior fat pad. The part that's bad is if you have what's called a sales sign. That means that that fat pad is bulging up off the bone, and that means that there's some kind of joint effusion. So I'm going to keep our normal up here at the top to reference, and let's throw in another picture here. So can you see the fat pad here? It's this right here. It's this dark area. And that means that there's a joint effusion. That's what you're seeing is fluid. And this joint effusion means that there's an occult fracture and we need to splint this arm. So that's called the sales sign. It's not that nice flat one against the bone. It's bulging out. It means there's an effusion. So you can see it, draw it in there. And you can see why that kind of looks like a sail, I guess, bulging up off there. And again, we need to put this patient in a splint because there's an occult fracture. Here's another example. Do you see it? So it's coming up across here, it's bulging up off the bone. There you go. And here's one more. This one's huge. This is a big effusion bulging all the way over here. Okay, so there's the anterior fat pad. Now the posterior fat pad you should never see on a normal x-ray. It's always a bad finding if you see it. So here's a normal x-ray and you don't see that dark strip here at all. There's no posterior fat pad. So if you see it at all, that means there's an occult fracture. You need to put the patient in a splint. So here you can see it. There's the posterior fat pad, and that's always bad if you see it. Here's another example. You can see it bulging up off here, and here you can see there's an anterior sales sign as well. So we definitely need to put that patient in a splint. Here's one more. Here's a posterior fat pad sign. That patient's going in a splint. Okay, so we've looked at our fat pads. Next up is alignment. There's 2 different lines we're going to be looking at, and that's the anterior humeral line. So we're going to draw that on the anterior side of the humerus, and it should intersect the middle third of the capitellum, right here. The second line is the radiocapitellar line. You're going to draw it down the radius, and again, it should go right through the center of the capitellum. So let's look at some examples. Here's the anterior humeral line going down. This is in a normal adult, where it goes right through the middle, and here's in a normal kid. So you can see even though the capitellum is smaller, you can still go straight through the middle of it. So here's some examples that are all bad. These are all abnormal. Draw it down. It goes anterior. Here's the capitellum. It's going anterior to it. Here it does intersect the capitellum, but it's on the anterior third. That's not correct. And here it's going on the posterior third. So, and this is one more reason it's important to check that figure 8. Remember the first one? If it's not a well-aligned x-ray, this anterior humeral line is not going to be accurate. So here you can see we have the figure 8 in all of these x-rays. See that figure 8 there? Make sure you check your figure 8 first so that you know that this part is accurate. Okay, next we have the radiocapitellar line. Here's 2 normal examples. This is true on both an AP and a lateral, so you should be able to draw the line down, and it goes through the center of the capitellum there. Here you go, and it goes through the center. So there's 2 normal examples, and it's true regardless of age. These are all normal examples of kids of different ages, both AP and laterals, and you can see it's always going straight through the middle of the capitellum, regardless of age. Here's an example that is not so good, right? So here you can see you draw the line down, and it's not going through that center anymore. That's a bad thing. One more example. This one's really off. Doesn't even go at all. Doesn't overlap it on either the AP or lateral. Okay, next we're going to look at the bones themselves. And you have 3 things that I want you to look at here. It's the radial head, the distal humerus, and the olecranon. And this is so that you can really concentrate on the cortical surfaces of each. So starting off with the olecranon, here's examples. These are all fractures of the olecranon. You can see there's cortical disruptions. Here's radial head. Make sure you look at both AP and lateral. This one, for example, you probably miss on a lateral. See right there, it's cortical disruption. The one other thing for the radial head is sometimes it's just an angulation. So this is actually a fracture right here. It's very subtle, but it's that odd angulation right there, and that's abnormal, and there's a sign that there's a fracture in there that you're not seeing very well. Lastly, we have the distal humerus. Here we can see this is a lateral condyle fracture. You can see the disruption right through there. And this one, if we look through our olecranon, we see that there's some cortical disruption. That's a supracondylar fracture. Last up is just to go through your ossification centers. I'm going to talk about these in a different video, but the mnemonic, just as a quick reminder, is CRYTO. So just make sure that you pull up a sheet if you can't quite remember what your ossification centers are. Make sure you identify what age your patient is and identify all your ossification centers to make sure that you're not missing a fracture. Let's review the 5 things you're going to look at. You're going to identify your figure 8. You're going to look for your sail sign anteriorly and your posterior pat sign posteriorly. You're going to draw your 2 lines to make sure everything looks aligned. You're going to look through 3 bones individually, make sure you don't miss anything, look at each cortical surface, and then just go through your ossification centers. So that's a good review of elbow x-ray reading. Here's some references, and thanks for joining us on EM in 5.